Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager at THECONNECTSHOW@gmail.com for podcast show details. Welcome to Passionate World Talk Radio. Educate, enlighten, entertain. Welcome back to Passionate World Talk Radio Network, a subsidiary of Global Media Network, LLC. And today, on Cool Your Heels with your host, Lillian Caldwell, we will be speaking with Lisa Skinner, who recently wrote a book about truth, lies, and Alzheimer's. Good afternoon, Lisa. How are you doing today?
Good afternoon, Lillian. I'm doing just fine, and thank you for asking me to be a guest on your show. Appreciate it.
Well, to tell you the truth, I think there's a lot of misinformation as well as information out there about Alzheimer's. And I know that there's a lot of people out there who are also caregivers to spouses, family members, friends, who really need to know what exactly is going on and also understand the behavior of people who have Alzheimer's, but they need to know the truth at the same time. It shouldn't be sugar-coated because Alzheimer's is not a sugar-coated illness.
I couldn't agree with you more. And I have been doing this professionally for 26 years now as a behavior specialist. I have counseled thousands of families and helped guide them through this illness. Plus, I have had 8 of my own family members suffer from one of the brain diseases that causes dementia. And I can honestly tell you that the biggest takeaway that I have found to be true in the last 2.5 decades is people's lack of understanding about what this disease does to their loved one and what it's really like to live with this disease. The main association that people make with Alzheimer's disease and dementia is that it's a disease that causes memory loss and confusion. However, that's not necessarily the case. It's actually a very, very complicated disease with many, many layers. And then to throw another complicated layer on top of that, many people suffer from what we call mixed dementia. So they may have 2 different types of brain diseases occurring at the same time. So it's not unusual for somebody to have Alzheimer's disease and, let's say, vascular dementia at the same time. So the damage is being done to different parts of the brain. And there are so many symptoms, hundreds of symptoms that follow these diseases, and that's what we use. That's where the term dementia comes in. That's actually an umbrella term used to describe the symptoms and behaviors that accompany one of the brain diseases. And typically we refer to Alzheimer's disease because it is the most common and more people suffer from Alzheimer's disease than any other brain disease that causes dementia. So that's the one that we, are typically referring to. But my objective in everything I do, including the books I've written and the training course that I have, is really developed to help people have a more comprehensive understanding about this disease. And the key that I have found to the journey of this disease is to be prepared for the unexpected, because you never know what is going to show up on a daily basis.
Absolutely. My husband had Alzheimer's. And even though I knew about the disease, he had it for several years. And then he died from a blood infection and pneumonia that kept on coming back. And they couldn't really contain it unless they gave him large doses of steroids that completely wiped him clean. And I think people need to realize that Alzheimer's and dementia are what I call individualized diseases. They strike people differently. There's not one method to handle their behavior or what they're enduring, because they don't understand what's happening to them per se.
That is another truth about the disease that I think people should be more aware of. There's kind of a saying in our industry: if you've met one person with Alzheimer's disease and dementia, you've met one person with Alzheimer's and disease and dementia, because what you're saying is absolutely accurate, that no two people experience the disease in the same way. And again, people can be suffering from more than one brain disease. So there's more going on than kind of meets the eye, so to speak.
And I think it's important for people to understand that. I know that if you're not cognizant of your spouse or a peer or a mother or a father's behavior, it's very difficult to come to grips when they suddenly become violent or when they suddenly get disoriented or they have hallucinations or their behavior takes a 180-degree twist and they do something that normally they would not ever consider doing. And people need to realize that this is not a personal attack on them. It's what's happening with the person with the illness. Yes.
I'm curious, since you mentioned that your husband had Alzheimer's disease, while you were going through that with him, hindsight's always 20/20. Do you wish now that you knew more about the disease back then than maybe you did, or do you think that you were prepared for the unknown, for the unexpected?
I think I wish that somebody had educated me to at least understand what was happening. He had a history, his family had a history of having Alzheimer's. Every woman in his family going back 100, 200 years has had Alzheimer's. But he also knew that he would get it as well, and yes, he did. And this gentleman was like Clark Kent. I don't know if that's your generation or not, but he wasn't
Superman.
Oh, yes. Okay. Yeah. Well, the Superman didn't quite come out, but he was a wonderful, kind, very patient. He was a university professor. So that should tell you a lot right there. And yet, when he had the illness, he had anger issues. He would strike out. He would say things that in his right mental state he would have never have said. And when you're a caregiver and you're so close to that person, especially if they're a spouse, it's really hard to rein yourself back in and say, he didn't really mean that he's not in his right mind. because some of the things that come out of their mouths, they hurt. And they do get under your skin. And I don't think anybody is really trained, even if you've been a mother. It's different when you're taking care of a child who has an illness or something than to have somebody whose brain has been rewired and he says vicious things.
Right. And there's that fine line between your logical brain and your emotional brain, because logically it's easy to say, this is the disease. But when you're in the eye of the storm and these things are being thrown at you and happening right and left, your emotional brain kind of takes over your logical brain, and it's difficult to be empathetic to the fact that this is the disease that you're seeing, and kind of disassociate yourself from your emotional attachment to that person. That's where that's where the really is, because I've worked with so many families, and logically they can say, yeah, I understand that. I know this is the disease. But then when they are challenged or have an encounter with that loved one, and it just cuts to the core of years and years and years of their relationship, it's hard not to hurt from that. So how do you find that balance? And that's really where the challenges come in for family members and caregivers.
I really think that a book like yours, and from some of the other work that I've noticed you're doing, is really necessary. And I almost would think that it's a type of thing that hospitals and doctors should probably offer, because most of the caregivers are ladies, the wives, the daughters. We're the ones usually who start taking care of these folks.
Yes.
I mean, we're pretty much in our DNA, I'll put it that way. And we're the ones who are usually taking care of them, and yet, like parenthood, you're not really given a book to follow. You're not given an outline to consider. And the way you would handle somebody who has, for example, cancer is different from the way you would handle somebody who has dementia, Parkinson's, or Alzheimer's.
Everything
it's a new ball game.
That's exactly what I tell people, and everything you're saying is 1,000% accurate. It sounds like it certainly has been your experience. It's been my experience, and it's been the experience of thousands of family members in the world who are really challenged by this disease. And the thing, Lillian, that it makes it even more difficult is it's not a disease that lasts a short period of time. It has a very, very lengthy course. My grandmother lived with it for 20 years, and the average period of time that a person lives with Alzheimer's disease is 4 to 15 years or 4 to 12 years. That's a long, long time to go through.
It is a long time, and it's a long time for whoever. I mean, when my husband was diagnosed, the neurologist says, find a nursing home, dump him in it, and go on with your life. And I was shocked. Shocked when this guy said that to me. I said, I don't know about you, but when you get married, it's a convenience between you and your spouse. You just don't dump anybody. So what do you think about that?
Quite frankly, I'm also shocked that your doctor would have said something like that to you. And I think that's pretty extreme, but I cannot help but say that I hear from a lot of family members that once they get their diagnosis from their physician, whether it's a neurologist or a primary care physician, they basically are left to their own devices. And one of the biggest complaints that I hear, and it certainly sounds like this was your experience, that they don't give you any resources. There's no manual, like you say, and they don't say, well, you really need to learn as much as you can about this disease because it's very complicated and you need to be prepared for the unexpected. Very few doctors are telling their patients that, and they're not giving them the guidance and the resources of what their next step needs to be, and they feel like they're thrown in the deep end without ever having had a swimming lesson, and they have to fend for themselves. And we need to change that, just like you said.
We
need to change that.
We need to also to create, as far as I think, is to create a national support system for caregivers. And that can be regular moms, dads, parents, grandparents, but it can also be for the nurses who are involved with these people in nursing homes or in other places as well. Not everybody can afford to put their loved one in a nursing home or independent living or assisted living. So they have to learn how to work with them and not only be able to take care of the patient, but they have to take care of themselves as well. And people who I have spoken to, especially the men, are bitter about having to deal with a wife or a mother who's had Alzheimer's. I mean, they're just so enraged that there was no one there that they could reach out to help them keep an even keel emotionally, physically, and mentally.
It's a very helpless, hopeless feeling to be kind of thrust into that situation. And it's very difficult, especially for spouses when they've had a partner for, 40, 50, 60 years, and then all of a sudden they have to be the primary caregiver to somebody that basically relies on another person for all of their activities of daily living. They can't do anything for themselves at some point of the disease. So it's it's a bitter pill to swallow for a lot of people. And just like you mentioned, I see this as being the next world crisis because the baby boomers are aging in place now and have reached the age where Alzheimer's disease begins to show up. And because the baby boomer generation is probably the largest human population in history to date, the numbers are projected to double worldwide by both the Alzheimer's Association and the World Health Organization by the year 2050. And COVID had a huge impact on how we're caring for our loved ones now that, COVID left a huge wake in its place, and we're seeing a major shift in how people are cared for with Alzheimer's disease. A lot of people are bringing their loved ones into their homes versus assisted living, but the difficult part of that is there's no insurance unless a person already had a long-term care insurance policy in place when they became symptomatic, or they happen to be a veteran that qualifies for vet benefits. It's all private pay, and the cost of care is prohibitive. So,
let me put that in perspective for those who want to know. I'm in Pennsylvania, folks. 3 years ago, before my husband passed, he was in a 24/7 health care facility at $14,000 a month.
Right.
It's now 3 years later, and we're talking three-digit inflation.
That's
so
right.
That same care today would be around what, $17,000, $18,000 a month?
I know people down here in California who are paying that. Yes.
So that's about right, and it will only go up. Now,
yeah.
I had my husband was very lucky. His dad was a CPA. He taught his son all kinds of things about money, so he was able to put away, and he had the long-term care that he took out when he was a young man. So in that respect, we were in good shape. However, not everybody has that kind of training from dad or mom or from an uncle or aunt. And a lot of people don't have those kind of funds or the wherewithal to say when they're in their 20s, well, maybe along the way I'm going to get really sick and I'm going to need something to protect me. So
right.
He went out. Of course, he already figured he would get Alzheimer's, so he invested in a long-term health policy to see him through. And also, you should know it can come off on your taxes. If your Medicare or your supplementary income will not pay for this extra stuff, it will come off on your taxes. So go talk to your CPA. How do I know this? Because I went through it. But you should be aware that this is what you can do and just save all your receipts. But I really feel that unless you've gone through it or unless you talk to people about it, there's a lot of misinformation or no information out there that can help, say, a middle-income person or a low-income person to deal with a spouse who has Alzheimer's. And I don't think many of them would understand what to do, even if maybe they were protected financially.
I agree with everything you're saying. And then to make matters even worse, if they are put in a position where they have to bring their loved one home and be the primary caregiver, even if they share in that role with other family members, they're not prepared because, like you said, it's not like, taking care of cancer and it's managed through medication and all these other resources and options are available. This is dealing with somebody that is losing their identity and losing their ability to think, to reason, to do anything for themselves. And I have not seen where people are really prepared for the extreme of what this disease does to people.
The inevitability of what happens. I mean, there's a larger picture, ladies and gentlemen, besides just the physical, mental, and emotional care that's associated with the person who has Alzheimer's/dementia, because you, the caretaker, are responsible for a lot more than just their basic care. So it's a snowball effect.
That's a great way to put it. And I read people's posts on LinkedIn and Facebook. There are support groups, and it breaks my heart when I read the anguish that family members are going through and suffering from trying to take care of somebody with Alzheimer's disease. It's heartbreaking.
And so if a person went out, for example, and picked up your book, what can they hope to gain from your book?
I think the biggest takeaway that somebody's going to get from my book is to have a better understanding of what this disease does to their loved one and what to expect on a day-to-day basis and things to look for. And then I offer counterintuitive solutions to how to react and respond to the various symptoms and behaviors that show up as a result of this disease. And that's a good place to start because it's probably going to prepare you more than you are if you don't gain the knowledge and the education of what this disease is really all about.
And I think it's important that you do this. Now, you have a website they can go and visit? Is there a direct link to Barnes & Noble, Amazon, where they can pick up your book?
Yes, and the name of the website is the same name as the book. It's called Truth, Lies, Alzheimer's, no apostrophe between the R and the S.com. TruthLiesAlzheimer's.com. And yes, you can purchase the book from the website, or you can purchase it from Amazon or Barnes & Noble. And the website actually is filled with a lot of valuable information.
Terrific. And is there a contact email where they can reach you?
Yes, it's on the website.
Okay, great. So everybody should be able to go over to the website with the name of the book, Truth, Lies, and Alzheimer's. And if you feel that someone in your family is about to be diagnosed, then this is a good reason for you to go out and buy the book. I know Christmas is 6 months away, but if you have a history of Alzheimer's in your family, go out and get the book as a present for the people who are going to be the responsible caregivers for this person. It'll be the best thing that they've ever received to help them on their journey with this illness. Can't stress it enough. Do you have anything else to add, Lisa?
We haven't completely completed, but I will, my co-author and I, Doug Collins, we will be offering a training course for families on this very subject. So you can go on the website and watch for more detailed information about that. And this is a brand new thing for us to help prepare people for this journey. Really getting down into the weeds and talking about the day-to-day things that'll come up, and then not only just what to expect, but how to deal with it. And I think that that's going to be very, very important for people to be prepared for dealing with this disease.
Absolutely. And I have one more item. I know in Pennsylvania, they have a organization that helps people with spouses on Alzheimer's and on aging. And you can write to them directly, email them, and get all kinds of information. And they also have ways of helping you. So you may want to contact your state, whichever state you live in within the country, and see if they have something, an organization that deals with aging and the different illnesses that one gets as one ages. Alzheimer's and cancers are usually the top two that they concern themselves with. As one doctor said, you're either going to die from cancer or Alzheimer's, so learn all you can about both. Yeah, that didn't make me feel any better either. It's very scary. Yeah. So, ladies and gentlemen, thank you very much for joining us this afternoon with Lisa Skinner about her book on Truth, Lies, and Alzheimer's. And you can listen to this program, Cool Your Heels, with host Lillian Caldwell, all over again on Spreaker, on iTunes, iHeart, our website, https://passionateworldtalkradio.com. A blog is written with more information that you can find out about Lisa, her co-author, about the book, how to get access to her website, and everything you need to know. Thank you all very much for listening, and remember, please keep listening. Thank you. Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager, at THECONNECTSHOW@gmail.com for podcast show details. Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook, Facebook Live, LinkedIn, and all the other podcast directories one can find on the internet.